The state announced this week that only 1% of workers at Indiana nursing homes have tested positive for the virus. Yet new numbers also show that most of the state's COVID-19 deaths have happened at long-term care facilities. So how is this possible? Call 6 Investigates' Kara Kenny is digging deeper to find out what could explain the numbers.
During the month of June, the state tested most of the state's nursing home workers for COVID-19. This week, they released those results. Dara Hendricks, a Crawfordsville nursing home worker, tested positive for COVID-19.
But I'm scared.
She tells me she is still struggling with a cough months after her diagnosis. Dara quit her job right before the state started testing nearly all nursing home workers. In all, the state tested 46,201 employees at long-term care facilities. 466 tested positive for COVID-19. That's 1%. Numbers also released this week show 60% of the state's COVID-19 deaths have been residents at long-term care facilities. We asked the Indiana Healthcare Association why. They represent nursing homes.
I think what we're going to see is a lot of the tragic loss of life that occurred early on in the pandemic. And that was when the country was caught somewhat flat-footed. And prioritization of PPE and testing just wasn't with long-term care at that point.
President Zach Cattell says since the early days of the pandemic, availability of PPE and testing has improved greatly.
It's been weeks since I've heard of facilities having shortages of N95 masks.
Also, facilities improved their infection control protocols. State officials had hoped June's round of testing would show them trends so they could target future testing, but no such luck.
Even in counties with prevalence rates that were less than 3%, we had facilities with significant number of staff who were positive.
The state plans to test all nursing home workers again in August, a key to preventing future outbreaks at nursing homes. So far, 12 workers have died across the state. 1,618 long-term care residents have died from COVID-19.
But at the end of the day, long-term care cares for the population that's most at risk.
In 2 weeks, the state plans to release a dashboard that will include nursing home deaths and cases broken down by facility. That information will not, however, show where nursing home workers worked that died from COVID-19. Reporting at the State House, Kara Kenny, RTV 6.